Hi everyone, this is Marianne Ross. The title of my paper was Social Policies and Global Aging. One of the issues we face in the 21st century is global aging, posing both challenges and opportunities for the developed nations. The major economic concern is population aging. We are getting older. Turning 70 today is not like turning 70 20 years ago. We don't have a one-size-fits-all any longer. We've had an increase in life expectancy with advancements of medical technology, nutrition, and just general living. 3 countries I profiled in this paper were Denmark, the United States, and Japan. All developed nations face challenges in retirement and long-term care. We all have some sort of guaranteed income and medical insurance. The question becomes, how much do we have as an individual, and how much does the government supply? Social policies, as we move forward, will need to change. The question becomes, where does the responsibility lie? It's a state versus individual question. The elderly still have the fear that family, communities, and nations still do not care for them. Denmark is a population of around 5 million people. It's a very homogeneous country, about the size of Rhode Island. 65 and older accounts for about 15% of their total population. 80 and older accounts for about 4%. As of 2012, their life expectancy was about 80 years old. This is an average of male and female. Females tend to live a few years longer. Average age of females in Denmark is around 83. Denmark falls under socialism. It is a country where benefits are universal and everyone is entitled to them. Denmark has always been known for the place to be taken care of from the cradle to the grave. Some of the policies around the Danish government is the support the elderly to provide them with as much individual resources as possible in order for them to live a high quality of life. The Danish government truly believes that citizens are responsible for themselves and their family members. And they do everything in their power to allow elderly to stay in their home and live an independent life. Some of these resources include round-the-clock home health care and transportation. The pension system is nationally funded between the employer and the employee. The employer contributes about 2/3 and the employee about 1/3. In order to collect 100%, starting at the age of 65, a citizen must have lived in Denmark for 40 years after the age of 15. Companies also provide their own pensions, and of course, individuals can set up their own private pensions as well. The United States, as we know, is a melting pot consisting of a very diverse population. We have a population around 315 million people. 65 and older accounts for 40 million, about 13% of the total population. 85 and older accounts for about 10% of the population. As of 2012, life expectancy was 78 years old. Again, this is an average between males and females, females tending to live longer than the males. The United States is largely a system of haves and have-nots, very unequal on many levels. Some of the policies include Medicare and Social Security. Medicare is the National Social Insurance Program. This is designed for citizens age 65 and older. This covers hospital insurance, medical insurance, and prescription drugs. All are covered under the program starting at the age of 65. Social Security is more known for our social welfare program, our pension. This is a pay-as-you-go system, and this system consists of 40 credits. To have earned 40 credits, you must have worked in the working world for 10 years. This poses problems to many people who don't necessarily work under a corporation. Again, there are private pensions and 401ks which provide the income supplements. Social Security has changed over the years and is now not necessarily a system you can live off 100%. Japan is the 10th most populous country in the world, population of around 127 million. Again, also a very homogeneous population. They are known as housing the oldest of the oldest. They have some of the oldest people, a higher percent of the oldest people that are living in this world today. Their percentage of 65 and older is around 22%. 80 and older, again, is the highest percent in the world and growing. And as of 2012, they had a life expectancy of about 83 years. Again, this is an average between male and female, females living the longest. In fact, Japan is home to the second country with the oldest females in the world. They have a universal health care and a nationally funded pension policy. As traditions become outdated in Japan, new forms of a healthcare system had to be established. And in 1961, a universal healthcare system was. This included cost-saving measures and also included facilities such as the picture on the slide, the Toyama-style daycare center. This incorporates the elderly, children, and disabled under one roof. This is, in my opinion, a brilliant idea. It allows the elderly to stay active, keeps their mind sharp, it interacts the children with the elderly, and it allows for the disabled to also be social. Medical facilities in Japan are non-profit. The government regulates all the fees. Citizens are responsible for anywhere from 10 to 30% of the bill, and the balance is paid by the government. Long-term care prevention-oriented system. This is community support services that are in place in all the cities in Japan. And these are services that provide the elderly with, for instance, training of muscles, a physical education, physical activity, improvement of nutrition, and dental care. Their pensions are also nationally funded. There is a mandatory enrollment from the ages of 20 to 60 to pay into these pensions. And you qualify after paying into the system for 25 years. Additional companies can also offer pensions. And additionally, obviously, a citizen can create their own private pension. I added also a picture on the slide of the current oldest living person. She is 116 years old. I think overall attitudes towards the elderly need to change. We still do not embrace them. We still see them as a nuisance. But the reality is we are all getting older. We are getting older and the population of aging is continuing. So all of our perceptions need to change. Developed nations can learn by studying the successes of others. For instance, in this paper, just the